Hey guys, it's Dr. Sam Robbins. Today I have a very important video for us guys. It's about prostate growth and prostate cancer, so please make sure you watch all of it, especially to the very end. Now, I received lots of emails from guys concerned about their prostate. They ask questions such as, what are the symptoms of prostate cancer? How do I know if I have it? Or how can I tell if my prostate has grown or if maybe it's too large? And also, what can I do to shrink my prostate or just avoid cancer? And these are all valid and actually smart questions, considering that the number one cause of cancer to kill men is actually prostate cancer. And these days, it's happening in younger men, and the problem is actually just growing faster. Now, not only is this clinically validated, but I also know this firsthand because my cousin is a urologist, and he's told me all about the prostate situations, how it just keeps getting worse and worse every few years. Not to mention, I've also had two uncles who have died of prostate cancer, and thus I'm fully aware of the problems, the causes, and the solutions. So first, let's start with the potential symptoms or warning signs that you may have prostate cancer. Well, let's start first with the bad news. And the bad news is that in most cases, prostate cancer symptoms are not apparent in the early stages of the disease. However, the good news is that there are two simple tests that you should do, especially after the age of 40, to help figure this out, and I'll tell you more about these in just about a minute. Now, because the prostate gland is close to the bladder, this is where the urine is held, and the urethra, this is where the urine comes out of, prostate cancer may be accompanied by a variety of urinary symptoms, especially in the early stages. Now, depending on its size and location, a tumor may press on and constrict the urethra, inhibiting the flow of urine. So some of the early prostate cancer signs could include burning or pain during urination, difficulty urinating, or trouble basically starting and stopping while urinating, more frequent urges to urinate at night, when you're sleeping. Also, this is very common. Loss of bladder control, decreased flow or velocity of the urine stream. Basically, it's just it's like really not happening. It's not strong like when you were young. Blood in the urine, blood in the semen, difficulty getting an erection. Yep, erectile dysfunction is a potential symptom and cause, symptom, and also painful ejaculations, if you can even have the ejaculations. Now, something I want to point out, not that, these symptoms are not always a sign that you have prostate cancer, right? So don't worry. It could simply mean that your prostate has grown or overgrown, which happens to most men as they age. It's called benign prostatic hyperplasia, or BPH. It's not cancer, thus the word benign. However, this is also a warning sign that cancer may happen, all right? It's you're making a prediction, and that if nothing else, you need to shrink the prostate, because your penis is not going to be happy and life is going to be uncomfortable, to say the least. And now the good news. There are two easy and simple ways to find out if you have potential prostate cancer or just that your prostate has overgrown and needs to be dealt with, this problem, this situation. The first is a digital rectal exam. This is basically when the doctor will insert his finger in your anus to feel your prostate for signs if it's gotten big or it's overgrown. And the second is a blood test for what's called a prostate-specific antigen, or PSA, which is basically a protein that can indicate prostate cancer or inflammation, depending on how high the levels are, as well as other hormonal factors. All right, so now that we know the symptoms, let's talk about the potential causes of prostate growth and cancer. Now, as usual, genetics always plays a key role in anything with the body. However, as I've stated over and over and over again in the past in all my videos and blog posts, genetics aside, the primary cause of how you look and feel, including getting diseases and cancers and so forth, are your hormones. More specifically, the imbalance of your hormones. For example, idiot doctors, the idiots, will say that the cause of prostate cancer is testosterone. And that's why the solution, believe it or not, is chemical castration. Thus, they give you drugs which turns off your testicles so they produce no more testosterone. And yes, this shrinks the prostate. But it's not because of the non-existent testosterone. It's actually because of the negative hormones that testosterone converts to. which is DHT, dihydrotestosterone, and more importantly, and worst of all, estrogens, the female hormones, which we all have. If high testosterone was the cause of prostate problems, then all the younger guys, right, in their teenage years, in their 20s, would have prostate cancer or prostate problems because this is when testosterone is at its highest, right? However, there are zero issues with these younger ages with super high testosterone levels. Yet men who have prostate problems after the age of 40, and more specifically around their 60s, this is when testosterone is actually at its lowest levels. However, this is also when the negative hormones that I mentioned earlier, DHT, dihydrotestosterone, and estrogen, are at their highest. Again, the imbalance in hormones. Now, this is why, personally, starting at age 20, I did everything possible to increase my testosterone levels while lowering my DHT and estrogen to normal lower levels. I optimized my hormones and created that perfect balance. And the end result is almost at age 50, I have the hormone levels of a young 20-year-old and a very small prostate with a low PSA score of 0.4 nanograms per milliliter. Men my age have around 2 or 3, not 0.4, 2 or 3. That's 4 to 6 times more than me. And if you're between 4 to 10 nanograms per deciliter, this is a warning and a 25% chance you have prostate cancer. And if you're over 10, this is very dangerous. And there's an over 50% chance that you have prostate cancer. And I, again, with my hormones being so optimal, I have a very high sex drive. And I never have erection or erectile issues. Again, fix the hormones, guys. Balance and optimize them, and you'll fix most of your body's health issues, including prostate problems and prostate cancer. Now, if you want more information about this, I've done other videos about this topic because it's so important. Below in the description area, I've listed important links and videos on how you can, first of all, quickly and naturally optimize your hormones and thus dramatically improve prostate health and your erections, as well as the real cause and cure for prostate cancer. Please make sure you take a look at these important topics and videos because I care about you. All right. I don't want you to get prostate cancer like my uncles did. All right. It was too late for me to help them, but I hope I can help you. Prostate problems can be avoided and fixed. I guarantee it. Thanks for listening and have a happy and healthy day.